It was very exciting. Now, we have an epidemic of broken brains. And the question is, why are we all going crazy? Why are all becoming demented? We have to ask why. Not just what's going on, not just what we can do about it to treat the symptoms, but to find the fundamental underlying causes that lead to the epidemic of broken brains. And I'm going to suggest to you today that if you want to change your brain, you have to change your body. That the origins of mental illness and psychiatric problems and cognitive disorders and aging of the brain is not found in your head. It's found in your body. What I'm going to teach you today is how your biology becomes your biography. So overview for today is that I'm going to share with you just briefly the scope of the dysfunction we have, a fundamentally new paradigm for navigating through the maze of emerging scientific information, a map, if you will, a GPS system that will help you think differently about the same problems that you see in your offices and have extraordinary new solutions to offer that are based on new laws of biology that are emerging that teach us not only how to understand how to improve health, but to really fundamentally deal with the underlying causes once and for all. I'm going to briefly mention the causes of brain damage, as if you don't know what they are. Most of you experience them every day. The 7 keys to an UltraMind, which is the approach of systems medicine or functional medicine to the problem of broken brains. And then we'll talk about the solution. What are the things that you can do and you can bring to your patients in your offices to help you to apply these concepts in a practical way. And I'm going to spatter throughout this talk some cases and in terms of depression, dementia, childhood illnesses, ADD, and autism. The scope of this problem is enormous. There's 1.1 billion people worldwide who suffer from broken brains. By 2020, major depression will be the second leading cause of disability. 1 in 4 people suffer from major depression at some point in their life. The second leading category of pharmaceutical drugs prescribed today are psychotropic medications, right after statins. 12 million children have mental illness. But thank God we have Ritalin because it's so much easier than parenting. Probably the most effective drug I could recommend for your child is Ritalin. Mom, Dad said that strange men offer me drugs, I should just say no. Right? We are seeing a very scary trend of medicating kids not only with psychotropic, but now we're giving little children statins because of their genetic predisposition to hyperlipidemia or whatever mythology is being promulgated by the medical industry. We're seeing 1 in 10 children taking stimulant medications, 1,000% increase in the last 10 years. Autism's rates have gone from 3 in 10,000 to 1 in 50, an 11-fold increase. That's an 1,100% increase. What's going on? 1 in 6 children have neurodevelopmental disorders. Depression is epidemic. 1 in 4 of us will have major depression in our lifetime. Antidepressant use has tripled in the last decade, and they don't really work that well. 86% have side effects, 50% are taking them after 4 months. By the way, most people who have depression, 1/3 of them, have folic acid deficiency, and 60% of the population may carry 1 or more copies of the MTHFR polymorphism, which limits their ability to metabolize folate. Alzheimer's, another huge thing. The good news is we're all getting older. The bad news is we won't remember it. By 2050, it's estimated there'll be 14 million Americans with dementia, 30 to 50%. Almost 1 in 2 people over 85 will have dementia unless we do something differently. We not only have to keep ourselves healthy with hormones and so forth, we have to understand the fundamental underlying causes of disease. So, do we medicate this? What's the treatment? What's the process here? Well, I'm going to suggest to you that in order to think about this differently, you have to take a leap. And the leap is that a belief that diseases don't matter. That diseases, in fact, don't really exist the way we think they do, that the categories and classification systems we have are obsolete, that they're not tracked back to etiology and cause, that they're based on symptoms and description and phenomenology, and we have to put those aside in order to fundamentally see how everything is linked at the roots. So, autism and ADD and Alzheimer's and depression are all the same disease. They just manifest differently in different people. They're all signs of imbalances in 7 basic fundamental biological systems that we all share that are like the laws of Newtonian physics or the theories of relativity. They're the theory of medicine. They're fundamental laws of biology that we have to follow if we are going to be healthy. So my hypothesis is there's no depression, there's no bipolar disease or autism or ADD or dementia. That mental illness is a systemic disorder. It's not a head disorder or a brain disorder. Autism is a systemic disorder. Neurodegenerative disease are systemic disorders, and if you want to fix those problems, you want to prevent them, you want to treat them, you want to reverse them, and often cure them, that you have to think systemically, that you have to look outside the body, outside the brain and into the body. We have to get out of the name it, blame it, and tame it problem in medicine, which is reductionism, which is name the disease, blame the name for the problem, then tame it with a drug. In other words, you're sad and hopeless and helpless, have low libido, low appetite, you can't sleep at night. I know what's wrong with you. You have depression. That's just the name we give to people who have those symptoms. It doesn't tell us anything about the cause. And then we blame the name for the problem. And then we say, oh, I know what you need. You need an antidepressant. Well, that really doesn't solve the problem, because the depression could be caused by a dozen different things. It could be caused by hypothyroidism or by heavy metal toxicity or a viral infection in the limbic system, or it could be caused by B12 deficiency or folic acid problems, or various problems that we have yet even to identify that can affect the brain that are systemic. So you can do all the talk therapy you want and all the psychotropic medication you want, but unless you deal with those fundamental underlying causes, you won't get better. You can't talk your way out of mercury poisoning. And DSM-4, the categorization of mental and psychiatric illnesses, has 100% accuracy. In other words, it's very good at naming people who share those symptoms, but it has 0% validity. It doesn't tell us anything about the cause. And that's a quote from the head of the National Institute of Mental Health, Thomas Insel. So are we really suffering from a deficiency of fluoxetine? Is that why we're all depressed? Well, we're trying to take pills to make our performance better, but maybe there's a paradigm shift here. Maybe we moved from the reductionistic medicine over the last couple of decades to looking at holistic approaches and alternative therapies and integrative medicine, which integrates the best of alternative therapies with conventional medicine, but we're still treating conventional diagnosis. That's what I call green medicine, which is trying St. John's wort for depression or ginkgo for dementia. They won't work. We just spent $36 million of the NIH money to show that ginkgo didn't work for dementia. And if anybody asked anybody who knew anything about how the basic laws of biology work, it would have been self-evident that they wouldn't have worked. Because what are you treating? Because dementia doesn't even exist. It's not a homogeneous condition.